I feel like my child has autism. I'm having them see a psychiatrist. How do I know if this psychiatrist is the right person? How do I know if I can trust them?
A lot of women, autism, and girls, autism can be misdiagnosed, underdiagnosed, or missed completely.
And I think that's one of the positives as far as it being so popular on social media and so destigmatized, is that it can take some of the shame and some of the, hey, I'm different, there's something wrong with me, and dispel that.
It's very common. I've seen stats, maybe 30 to 50% of people with autism have ADHD as well.
30 to 50%? Mm-hmm. Did you guys know that over 70% of TikToks relating to autism contain misinformation in a study by Drexel University? Now, here to help separate fact from fiction, we have a very special guest, a subspecialized trained psychiatrist in child and adolescent psychiatry, who's an expert on autism, who I refer all of my child and adolescent cases to, Dr. Meghan Jain. Welcome to the podcast.
Thank you so much for having me.
Now, Dr. Jain has quite the pedigree. Let's see. Undergrad, USC, SUNY Downstate in New York for medical school, UCLA for residency, and UCLA, where she was actually the chief fellow for her subspecialty training in child and adolescent psychiatry, which is where you get the bulk of your training for autism. As far as the roadmap for today's podcast, we're going to talk about autism. What is it? How do you diagnose it? How do you evaluate for autism? What are the treatments, medications, therapies? We'll talk about hotter topics as far as like what's on social media, masking, autism in women. We'll talk about stimming. What is that? We'll talk about autism and overlap and comorbidities like ADHD. We'll talk about social anxiety. We'll talk about the Neurodiversity Movement. And then we'll get into audience questions. Sound good?
Perfect.
Okay, everybody. Now, Meghan, Dr. Jain, why don't we just start by telling the audience, like, what are you doing? What is your practice? What do you usually see on a daily basis? Like a quick bit on that. And then we'll dive into what is autism? How do we diagnose and evaluate it?
Sure. I co-founded a private psychiatry practice. It's called Ocean-Based Psychiatry. And I see children and adolescents and adults, 50-50. So 50% children and adolescents, 50% adults.
So Dr. Jain, what exactly is autism? How do we diagnose it, evaluate it? So I feel like it would be helpful for the audience. I'm going to go through the DSM Criteria, which is the Psychiatrist's Diagnostic Manual. And I'm going to go through the DSM Criteria. Maybe you can give it some plain language as far as how we diagnose autism. Sound good?
That sounds great.
Okay. So criteria A persistent deficit in social communication and social interaction across multiple contexts as manifested by the following. 1, deficits in social emotional reciprocity, such as abnormal social approach, reduced sharing of interests or emotions, failure to initiate or respond to social interactions. 2, deficits in nonverbal communication behaviors, such as poor eye contact. 3, deficits in maintaining and developing and understanding relationships, for instance, difficulty adjusting to different social contexts, trouble making friends, and a lack of interest in peers. So that is the first diagnostic criteria for autism. Any sort of like words on that?
That's a great question. I would say it's just this understanding that there are social differences in the way that an autistic person might experience a social interaction and interpret it. So those were all specific examples of what that might look like. For example, difficulty with eye contact or difficulty maintaining friendships, entering conversations, there's just some differences there than the typical population.
Absolutely. The eye contact is one thing that parents might notice first or soon or earliest. And I find that a lot of autistic patients, they find that developing and maintaining friendships is a lot of work. And that could be for all sorts of reasons. The difficulty, like cognitively empathizing and mentalizing with their patients, which we'll of course define. But they find that it takes effort and work. So whether it's because of that reason, whether it's because they feel like they have to mask, whether it's because they don't feel this like implicit drive to make connections, I think that this is like a accurate diagnostic criteria in the DSM.
Yeah, I think it's accurate in the sense that there's a difference. So it might not be that the autistic person appears to have that difficulty, but if they experience that internally, that counts.
Yeah, I agree. Now, criteria 2B, restricted repetitive patterns of behavior, interests, or activities as manifested by at least two of the following. 1, stereotyped or repetitive motor movements, use of objects or speech. For instance, hand flapping, lining up toys, echolalia, which you'll explain to us what that means. 2, insistence on sameness, inflexibility, adherence to routines or ritualized behaviors. 3, highly restricted fixed interests. And 4, hyper or hypo reactivity to sensory inputs or unusual interest in sensory aspects of the environment.
Yeah, so just to explain that in more simple language, for the repetitive behaviors, that could be any behaviors that are used to regulate. So that could be humming, fidgeting, rocking. These are behaviors that just help the person with autism feel more calm and feel more regulated.
Yeah.
Echolalia, which you mentioned, is just repeating certain phrases. So, that can show up in a lot of different ways. Sometimes it's more repetitive phrases, repeating the same exact phrase over and over, but other times it's more high level where you kind of learn the script of how to engage socially and you use those scripts. And that might not be something that other people even notice that you're doing.
Now, these are the two main diagnostic branches that you find in autism. Mm-hmm. Typically, they want to see these manifested or evidence of this in early childhood. That being said, sometimes the child is able to compensate and get away with like showing these symptoms in a clinical, obvious way. Mm-hmm. And these symptoms, if we want to call them that, do not become apparent until later on in life. So those are the two main diagnostic criteria as far as the DSM for diagnosing autism.
Right. And just to mention the other points in the second criteria. So we had the repetitive behaviors. We have the sensory sensitivities. So that could be being more sensitive to certain tastes, textures, clothing tags, that type, certain noises. So just having a lot of hypersensitivity or sometimes hyposensitivity. So needing a lot of stimulation, like loud music, for example.
Exactly. And that one is often forgotten, the hyposensitivity part.
Right. And then the last part we mentioned was the fixated interest. So having an unusually strong interest in one topic.
Absolutely.
That can be a hallmark feature as well.
Okay. Now, what's interesting, especially today in 2025, is as far as I know, autism used to be predominantly diagnosed in childhood. Mm-hmm. Although now you're seeing a change. You're seeing way more people being diagnosed as autistic or on the spectrum in adulthood. Mm-hmm. So let's start with like how, parents, they bring their child and they're wondering like, okay, I've noticed this and that. How do you evaluate a child and diagnose them as autistic? Like what goes into that?
So to diagnose a child, it's usually someone around the child is noticing a delay or a difference in behavior. So that could be delayed speech. The child might be not meeting milestones in terms of speech development. They might be nonverbal. They might be having difficulty with changes in routine or inflexibility, or they might not be meeting social developmental cues like smiling on time or doing joint attention. So that could be, pointing at something and wanting their parent to look at what they're pointing at. So it could be noticed by a pediatrician, a teacher, or a parent. And that's when they would go in for evaluation.
Yeah, and this is so sensitive because, imagine your parents, you have a young child, they're 1, they're 2, they're very young. And now you're noticing that, hey, is something different with my child? They're not necessarily keeping up with the milestones of development of their peers. Something seems different relative to the other children in the same age bracket. And, I would believe and I would understand that there's probably a lot of trepidation with, okay, let's take our kid and have him tested and potentially diagnosed with something. Maybe they're not even considering autism. And I imagine a lot of patients want to wait and see, like, okay, are they just going to catch up? Like, at what point? I mean, is there some threshold that you would want to wait to see to actually bring the child to be evaluated, generally, including for autism?
Yeah, so, development changes over the early years. So I think as soon as you start to notice those delays, it is a good idea to just get an evaluation because then you can help that child be set up with services and supports. So for example, if they're having a little bit of a speech delay, they might benefit from seeing a speech therapist, which you could get through the school or, through different funding sources. So it's helpful to have that early well, at that point, it might not even be a diagnosis, just early evaluation, just to understand where the child is. And then over time, those speech delays might, they might overcome that and start presenting like a neurotypical kid. So it might change over time, but it's a good idea to get services as soon as possible.
Yeah, and we're going to contrast neurodivergent versus neurotypical and what does that even mean a little bit later in today's episode. Now, there was a startling study that came out by the CDC. A 2020 study showed that 1 in 36 children have been diagnosed with autism, which is a 20% increase from the study several years earlier, which was 1 in 44. Now, the researchers in this CDC study say that, they claim that, hey, this is not that more kids are actually developing autism, that it's less stigma, a better ability to screen and diagnose these kids. Do you have, that's startling. 1 in 36, it's hard to know what to make of that.
Yeah, and actually now in 2022, it's 1 in 31. So it's
1 in 31.
It's even more than before. So if you think about it, in one classroom, the chances are high that there would be one kid with autism. And yeah, I do think it's due to better understanding. I think a lot more clinicians, teachers, parents are aware of the diagnosis. And so people are getting earlier services, earlier help, which is great. And also, we're starting to understand that a lot of how we viewed autism before was based on a predominantly male presentation with nonverbal cases. So we used to think of it as, male boy who doesn't speak much, who's obsessed with trains. And now we're understanding that it might present differently in different populations, such as women, BIPOC, LGBTQ. And understanding the differences in how it might present in those populations has led to an increase in diagnosis.
Yeah, I'm going to put a pin into that because I want to talk specifically about how autism presents in different populations. Like you said, classically, it was the Caucasian male that was, okay, this what autism looks like.
Right.
We've learned that it's not just that, like you just mentioned. Before we get there, as far as, let's say I'm a parent, let's say my kid is having these delays, speech delays, not pointing like you were mentioning. I bring my child to Dr. Jain at Ocean Bay Psychiatry. What does it look like? Like, how are you evaluating this kid for autism? Like, what does the actual evaluation process look like?
Yeah, so since I'm a psychiatrist, I'm doing a full psychiatric interview. So I'm looking for any comorbid conditions, which means any coexisting conditions such as anxiety, depression, ADHD. As far as autism, I do a basic screening. So I'll ask about some of the ideas we talked about before, any challenges in social communication, any repetitive behaviors, fixated interests, sensory sensitivities. If I hear any of those symptoms from the parents or they're explaining that they see a lot of that type of behavior, then I will refer that patient to get more extensive testing to rule out or rule in autism.
Got it. Okay. So you're screening. You're asking these questions.
Right.
If they, as part of this screening process, you think, okay, perhaps there is something here, you are now sending them to what? Like a neuropsychologist that
Yes.
specializes in children and adolescents?
Yeah, so I would refer them to get a neuropsychological evaluation, and that is done by a neuropsychologist who has specialized training in how to do cognitive testing, socio-emotional testing, and can perform the testing required to diagnose autism.
Got it. Now, you know, as an adult psychiatrist, I have a lot of referrals from parents or of parents that want their children evaluated. It's incredibly difficult, as far as I have found, to find a skilled child and adolescent psychiatrist, but also a child and adolescent neuropsychologist to do a thorough autism screening. Now, if anyone in the audience watching wants any references to skilled neuropsychologists and psychiatrists that can help with this sort of evaluation process, you guys can leave some comments. We'll leave some references because I know like a big part of the difficulty in getting an evaluation is the parents trusting that they're in good hands and finding the right person for the job. I mean, it's a pretty huge deal taking your child to potentially be diagnosed with some sort of neurodevelopmental disorder. So if anybody wants any references, they can leave questions or like ask me in the comments. Happy to do so.
So just a quick word for anyone living in the state of California, you can contact the regional center. They're able to do evaluations for autism, and that's included in their services. So that is one resource that any parent can have. And there are also private neuropsychologists. And, you know, sometimes it is helpful to get a private evaluation just because it sometimes goes into more depth, and a lot of the information they give you in that report can be used to obtain accommodations in the school.
Yeah.
So
that's hugely important. Now, and the regional center, I believe, does this for some like an affordable cost, right? Because, you know, a lot of the times having someone in the private world, like a private neuropsychologist, it can be quite expensive. I mean, this can be up to like thousands of dollars, right?
yes, it could be really expensive.
I mean, that's cost prohibitive for so many people. People live in California, Americans. So I'm glad you brought up that point that the regional center, we're going to leave a link for the regional center below, I believe offers these types of evaluations and services for a more affordable cost. Is that right?
Yeah, that's right. And also, there are some medical centers that provide neuropsychological evaluations. For example, I know UCLA provides some, and usually there's a waiting list. You want to, contact them sooner than later. But that is another avenue as well for parents.
Yeah, and what Dr. Jain was saying is like one of the reasons it's so important to catch this early is that then we can get services at school to help with, healthy development, attending to the child's specific needs.
Exactly. So every school has access to educational funds that can be used if a student has, what they call a disability. So with autism, sometimes you can obtain speech and language therapy through the school. You can also obtain just general accommodations. Sometimes it's easier to get certain types of therapy covered through your insurance if you have the diagnosis. So for all those reasons, having the diagnosis can be really helpful for families so that their kid can obtain those services, and that can help them, catch up and get to where they need to be. And the earlier the intervention, the better.
Absolutely. Now, while I was prepping for this podcast, today's episode, I heard a very interesting definition characterizing autism. And that was a tendency to withdraw from reality and become preoccupied with one's internal world. What do you think of that definition as far as characterizing autism? What do you think about that?
Yeah, I could see that. And I also think a lot of people could relate to that experience as well. If you're an introvert or if you have social anxiety. So, I don't think it's all encompassing, but I do think it explains a lot of autistic individuals' personal experience.
Yeah, I was fascinated to hear that. I also, I actually heard that from the Carlat Psychiatry, the people over there. Fascinating. And what I'm going to ask you, just kind of foreshadowing, the overlap with like this inattentive ADHD sort of like daydreaming child. I imagine that part of the like evaluation process, like you said before, is sifting through what is autism and what are comorbidities, right? What is like this young ADHD inattentive dreamer with social anxiety versus what is this like young, child that has autism. You gave us kind of that typical, male fixated on certain sort of like obsessive interests, difficulty socializing. But what does autism look like in women and females and young girls, for instance? Like, how do you contrast those two? Because I think that was missed. I think one of the reasons you're seeing more of a prevalence of autism now is that I think like a lot of these young girls, it was missed because they didn't fit that classic young male that we just described.
Definitely. With a lot of women, autism, and girls, autism can be misdiagnosed, underdiagnosed, or missed completely. So before I go into that, I just want to mention that Autism Spectrum Disorder is really just a constellation of symptoms, and no two cases are exactly the same. So there's a saying, if you meet one person with autism, you've met one person with autism. So it really just presents in a lot of different ways, which can sometimes make it easy to miss, especially in women. The reason why is, society has different gender role expectations in general towards women, and there's a lot more social conditioning happening. So a lot of women will engage in something called masking, which is basically camouflaging your feelings of being different. And a lot of girls will learn how other people interact and mimic that, or they'll use scripted language. They'll kind of observe how other females are interacting or just people in general and emulate that. And it's not intuitive. It's more like they're just kind of acting almost or masking.
Like the mask being, I'm neurotypical, I don't have autism, is like the
Right.
mask that they're putting on.
Exactly. So they're processing social interactions differently than a neurotypical person would process an interaction. But they've learned from experience that they start to recognize patterns of how people interact, neurotypical people, and they'll mimic that. So a lot of times it's hard to notice because they appear to have good social skills, which, they are exercising good social skills, but I think what's hard is they feel alone and they feel like they're different and that they have to act to get along with others.
Why are the females more likely to mask than the males?
I think women are encouraged to be more pro-social, not to make,
This is where the gender roles
It's
come
a
in, right?
generalization, but I do think there's more social pressure on women to conform. I also think, women are rewarded or young girls are rewarded for being well-behaved and being, there's less acceptance for women acting out of a social norm or expected
fascinating.
social norm. Also, I think women tend to have more socially acceptable fixated interests. Might be on fashion or might be, it could be celebrity culture, but it's kind of seen as a normal
Interesting.
interest and just with an unusual intensity. And lastly, I think their sensory sensitivities are either accepted by others without much question, or they could be seen as dramatic or picky rather than being seen as experiencing the world differently and having different sensory processing.
So perhaps like the pressures of the world on females specifically, like as opposed to the males, rewards or influences or pressures them to conform or mask, and perhaps like their interests seem more neurotypical than that of their like male counterparts.
Yes. And then lastly, I think a lot of girls will internalize their experiences. So if they feel they might suppress their stimming behaviors, they might suppress their feelings of being different, and instead they might present with anxiety, depression, eating disorders, which is sort of masking the underlying neurological differences.
Interesting. Now, let's get into, okay, so we have this patient and we've evaluated and diagnosed and we feel like they're on the autism spectrum. What does treatment look like? Like what goes into this? Now there's therapy. There's specific forms of therapy, which you'll tell us about, I'm sure. And then there's the medication route. Like, okay, we've passed the threshold. We have someone on the spectrum. What does treatment look like?
Yeah, so I'll start with medication first and then talk about therapy second. So there is no medication specifically for autism. We're either looking at treating symptoms that are getting in the way of functioning or any coexisting or comorbid mental health conditions. So, for example, in certain populations of individuals with autism, they have more aggression or irritability. In those populations, we would treat, we could use antipsychotics. For example, risperidone and Abilify have been FDA approved for irritability and autism. So that is for, certain people who are having really big tantrums and putting themselves at risk or other people at risk. You might consider using a medication like that. For the comorbid conditions, there's anxiety, depression, ADHD. Those are some of the most common. in those instances, we would treat those conditions with medication. But for the autism itself, there isn't a specific medication for that.
Yeah. And, I'm an adult psychiatrist. I have patients with autism. And, I'm often asked, okay, how are you treating the autism? And my response is, listen, I'm not. I have a patient, he has autism, and then we focus on his complaints. Hey, doc, I'm like really obsessive, or I'm having clinical anxiety or social anxiety. I'm in a depressive episode. Like you said, there's no like treatment like, okay, someone has autism, we're giving them this medication. We're treating, they're just a human being. They happen to be on the spectrum, and now they're presenting with their chief complaint, which for me is often, a mood or anxiety complaint.
Right, exactly.
Now, it's fascinating. So, and again, this is a spectrum, right? On one extreme of the spectrum, we have severely autistic patients that are nonverbal. They have a lot of aggression. They, a lot of the times, are in and out of inpatient psychiatric facilities. And it is a severe disorder that's incredibly functionally impairing and incredibly difficult on the families, which requires a host of different medications and sometimes even like daily, sometimes 24-hour supervision. On the other end of the spectrum, you have patients that are on the autism spectrum that no one would really even know are on the spectrum. Perhaps they have certain quirks, perhaps they have certain fixed interests, perhaps they have difficulty with like change and transition. So it truly is a spectrum. And I'll mirror what you just said, or I'll echo it. When you've met one autistic patient, you've met one, right? I mean, the spectrum is so wide and diverse. Now, here you're touching on aggression, for which we use atypical antipsychotics like risperidone or Abilify. And the audience actually likes a lot of like this med talk we've found through our prior podcasts. So they like getting the little nitty and gritty.
Okay.
It's like a risperidone, like a 0.5 milligram twice a day to start, or like an Abilify once a day.
Yeah.
And then the normal medications that we use for the comorbidities, SSRIs, hypnotic agents for sleep, so on and so forth.
Right. Yeah, with the irritability and aggression, I actually often use Guanfacine first, which is an alpha agonist. And I'll try to use the antipsychotics really sparingly. I am pretty conservative with those medications because there's a lot of side effects. It's an amazing medication for the right person.
Yeah.
But yeah, I'll be pretty conservative when I use those. But I definitely use them in the right situation.
Yeah. So Guanfacine for autism spectrum, one of the indications is irritability, agitation. How do you usually start dosing that? Are you using the extended release, immediate release? Like, how are you dosing Guanfacine for autism and irritability with agitation?
So if if a patient I see who has autism also seems to have some hyperactivity, I think they have ADHD as well. So they're hyperactive, impulsive. They might have bigger tantrums. They might be irritable. I'll usually start with the extended release, 1 milligram at bedtime. You can go up to 4, so I'll really try to maximize that first. A lot of times that works great, and then we're not worried about the irritability anymore. Sometimes, especially with the more severe cases of autism, it's really disruptive behavior in the classroom, at home. If there's hitting, violence, I might consider an antipsychotic at that point. With Abilify, I usually try Abilify first. I think risperidone is great too, but my go-to is Abilify first, depending on the case, but I lean towards that. I'll start at 2 milligrams and go from there.
You'll start the Abilify at 2 milligrams. And the Guanfacine, so in case everyone here has children or they themselves is on the Guanfacine, usually start 1 milligram extended release before bed. How do you consent that medication? What are the most common side effects? And how quickly do you ramp up and up titrate to 2, 3, 4? So the most important thing to know about Guanfacine is it's actually pretty safe.
It affects the sympathetic nervous system or the fight or flight nervous system, and it helps tamper that down. So the main side effects are it can make people tired the next day. If that happens, it might just be an adjustment, or if it's really significant, it might not be the right medication for you. The other side effect to know about is it can reduce blood pressure just a little bit by a few points. I think that becomes more relevant if somebody already has really low blood pressure. It might lead to symptoms like dizziness, lightheadedness. If that's the case, I will also discontinue the medication. Generally, I feel like it's very well tolerated. Occasionally, I'll see a paradoxical response where somebody starts Guanfacine and they get even more irritable, but that's very rare. I've seen that only a couple times.
How quickly do you up titrate to 2? Like, do you go as fast as 1 week? Do you give it more than 1 week?
I usually have people come back in 2 weeks. It works pretty fast. It works within 3 to 4 days, but I think sometimes you need that extra week to really get a true sense of what's going on. It's really for the parents' sake and the child's sake to have more time to observe before making a change.
Yeah. And so we have the Guanfacine. We have the atypical antipsychotic medications like Abilify that you like to use first line and then maybe get to risperidone. The Abilify you'll start at 2. Anecdotally speaking, how often can you actually effectively treat any sort of irritability or agitation in autism with one of these medications?
They work really well.
Yeah. So there's hope out there, guys. I mean, these medications work. They're well tolerated. There's first line agents like Guanfacine that Dr. Jain will go into that is well tolerated without a lot of side effects.
Which is technically off label, but I'll do that because it's just such a low side effect profile and it works so well for a lot of kids with autism that's just my first choice.
Yeah.
If I were the kid or if I were the parent, I would want to try that first. So that's why I offer that first.
Yeah. And then same question as far as like the Abilify. So you turn to it second because you said there's more risks of side effects. So the Abilify, So tell the audience a little bit. By the way, audience, if you guys want more or less on this straight med talk with dosages and side effects, let us know in the comments so we can refine and give you guys a level of detail that you want. So the Abilify, you started to, what are the side effects? What do you, like, how are you consenting this and explaining it to the patient and their family?
So first of all, I know the word antipsychotic can be scary, but it's really just a class of medications, and it's almost a misnomer because it can be used to treat a lot of different conditions, not just psychosis. So it's a medication that affects a lot of different receptors in the brain.
Yeah, exactly. And I tell my patients that in my practice, it is a misnomer. Because Abilify, for instance, if we have a fully psychotic schizophrenic patient, that might be 20 to 40 milligrams of Abilify. When we're using Abilify for this purpose or even to augment antidepressants in major depression, we're getting up to maybe 10 milligrams.
Yeah.
So don't let the word or the title of antipsychotic scare you. I'm so glad you brought that up. So back to the question, like, what do you tell them as far as consent?
Yeah, so as you said, we're in certain conditions like schizophrenia, we're using 40 milligrams of Abilify, but here I'm using 2.
Yeah.
So the side effects are less likely at such a low dose. But the other thing I wanted to mention before I go into the side effects is how life-changing of a medication it can be for the right person.
Absolutely.
It is a night and day difference for parents and also for the kids because they're able to control their impulses. They are a lot happier. They do really well. They get all this positive feedback. They develop more self-esteem. So it's really an amazing medication when used effectively. So that being said, in terms of side effects, the main side effects is it can increase appetite. I see that maybe 30 to 50% of the time. I don't know what the official statistic is. That's just what I see in my practice. And it's, if as long as you're eating healthy snacks, it's okay. I think it's when people are eating a lot of junk food, they might gain weight. If somebody is eating a lot more food and it's a lot more unhealthy, that can lead to metabolic syndrome over time, which is weight gain, prediabetes, that type of picture. But, that doesn't happen overnight. That's really from, an enormous amount of weight gain. And some people have a little bit of weight gain. Many people don't have any weight gain. And a few people get really hungry. If I see that, then I'll stop the medication most likely.
Yeah. There's a lot of options. We definitely do not have to concede that this is the only medication. It's causing a ton of weight gain. My kid might have a risk of getting diabetic or getting overweight or obese. We don't have to make that concession. There's other options out there.
I switch Abilify if somebody's gaining weight because, again, I wouldn't want to be in that situation. There's other options, so why?
Yeah, absolutely. Now, any other pertinent medications that you want to discuss before we move forward?
Yeah, just a couple more side effects. So another potential side effect is akathisia. That just means a lot of involuntary pacing and desire for movement. It's a little bit different than hyperactivity because hyperactivity is just constantly moving around and just being run on a motor and running around, whereas akathisia is more like you feel like you need to move. It almost feels uncomfortable not to move. And it's usually in the form of pacing. So if the Abilify is the miracle medication and you're having akathisia as a side effect, we can treat it with a separate medication. But that's another consideration. If I see somebody with that, I will consider switching as well.
Yeah. Any parent here that has an autistic child or anyone here on the spectrum on Abilify, if you have started this medication and you suddenly feel incredibly restless, I can't sit still, I'm physically uncomfortable sitting still, then this might be akathisia, which is a very well-known side effect of Abilify, and you definitely want to ask your psychiatrist about it. And again, if you have a child on this medication, keep your eyes open and be mindful. You do not want to mistake this for a hyperactivity or some sort of feature of autism, and continue your child on this medication that's giving them a distressful side effect. So everybody be warned as far as like this potential side effect of Abilify. Now, risk factors for having a child with, what are the risk factors for having autism or having a child that develops autism? I've seen some studies as far as like parental age, father's age. Is there a genetic component? I mean, what are the risk factors for autism, for developing autism?
So the biggest risk factor is genetics, which accounts for, I think it's 50 or 60% to 90%, depending on the study.
Wow.
So that's the number one risk factor. And, if you have an identical twin, the other twin has a very high percentage likelihood of developing autism as well. And it's multifactorial from a genetic perspective. There are many genes implicated, and we don't have a full understanding of that yet. Part of an autism evaluation is, if you do in fact have the diagnosis, is to get a genetic test just to understand if there's any genetic reason for the autism.
Yeah.
Or known genetic reason. A lot of them are unknown, but
have we identified, so like you said, I mean, just like we said how there's so many different presentations, it's a spectrum. There's not just one gene that, hey, if you pass this genetic material, your child is going to have autism. There's all sorts of genes. We have not identified all of them. So correct me if I'm wrong, but it's not as cut and dry as, hey, me and my wife are going to plan to have a child. Let's just get a genetic screening and see if we have the autism gene. It's not that simple, is it?
Yeah, no, it's not. It's many different potential genes. We don't really understand how they interact at this point. Certain genetic conditions, such as Fragile X syndrome, may really greatly increase the likelihood of autism, but we at this time can't account for every case of autism in terms of what's the genetics. But I know that's a big area of research right now.
So we've talked a bit about the medications, a bit about the risk factors. What sort of therapies are out there for patients on the autism spectrum?
I think it really depends on that individual's specific strengths and challenges. So, for example, if it's a more severe type of autism where there's cognitive impairment or difficulty performing activities of daily living, such as showering and, just getting through your day, that person might benefit from occupational therapy where they learn those skills on how to dress, how to take care of themselves, how to handle money. They might benefit from vocational training, so helping them learn some job skills so they can obtain a job. They might benefit from, there's a therapy called ABA or Applied Behavioral Analysis.
I think that's the most famous of the therapies, the ABA. What's it stand for again?
Applied Behavioral Analysis. It's basically using rewards and consequences to shape behavior. So a lot of times it would require, like, for example, if you want to teach somebody to interact in a specific way, you get a reward if you do it the right way. You get a consequence if you do it the wrong way. It's very simplified. I think it's good for people on the more severe side, but there's some controversy about it. Some critics say that it's kind of shaping people to act in certain ways rather than really addressing the underlying needs. But there's many new versions of it, and it's widely used. So that is an option. I think for individuals with autism who are, generally functioning really well in life, they have a job, they have a social life, they might benefit more from a therapist who understands autism spectrum issues and can help them navigate challenges they might be experiencing.
Yeah, like any other person, patient,
Yeah, like
adult,
anybody
child.
else.
Yeah.
We could all use that.
Yeah, I hear you. We've talked a lot about the comorbidities, and there is an overlap between patients that have autism and those that have other comorbidities like ADHD. How often are you seeing a comorbid ADHD in the autistic population?
It's very common. I've seen stats, maybe 30 to 50% of people with autism have ADHD as well.
30 to 50%? Wow. Now, for those watching, because I don't know about you, so like in my general adult practice, I have all sorts of people come to me and say, hey, doc, I think I might be on the autism spectrum, or I think I might have ADHD. What are some of the common features seen in ADHD? And then what are some of the differences that you see between autism and ADHD?
If we're looking at 3 domains, there's the focus domain. So with focus, a lot of people with autism have hyper-focus. They will really have a highly unusual interest in a certain topic, and they can spend all day focused on that topic. So that appears different than the neurotypical person who can't maintain that level of focus on one topic. With ADHD, it's a little bit more scattered. So it's still a difference in terms of focus, but it might be like, oh, look, there's a squirrel outside the window. And then just going down a different train of thought and not coming back to what they're actually working on.
Yeah. So in ADHD, you can see the hyperfixation in ADHD where there's this like prolonged concentration on something that they find particularly interesting.
Exactly.
But the distractibility, like, hey, right? Interesting. So perhaps in ADHD, there's more of that distractibility than you would see in the like hyperfixation in autism. Is that right?
That's right. That's correct.
Okay. And what else? Like what other commonalities and differences between autism and ADHD?
So there are differences in sensory processing. For a autistic person, that might look like very specific sensitivities to certain foods, textures, sounds. And someone with ADHD might have that as well, but generally there's sensory seeking, or they search out for stimulation. So
yeah. I've noticed the same. You have the kid that's like hypersensitive to smells, or like the way the texture of their sock feels on their leg. So that's also a difference I see. Tags on clothing.
Wanting chicken nuggets.
Exactly.
Only.
So that sensory component, I mean, I personally don't see much of that sensory component in ADHD. I know that it can happen, but that's also a way to differentiate.
Right.
The social aspect. Now, part of autism is they do have trouble with mentalizing, occupying somebody else's point of view. That sort of like empathetic, I understand where this person's coming from, how they're feeling, mentalizing. Now, I believe, you correct me if I'm wrong, but the mentalization component is also something I see in autism spectrum that I don't necessarily see in ADHD. Is that right?
Yeah, that is. So with mentalization, it's really understanding that somebody else might have different experiences and therefore different perspectives, different emotions, thoughts, and behaviors, like their own world, and they might be acting from that place. A lot of times with autistic people, they might not fully understand the perspective in a cognitive way of what might be going on for somebody else and why they might be doing what they're doing. With ADHD, I think what I see with the social aspect is it's more of like an impulse control issue. So they might understand what somebody else might be thinking or doing, but they just don't have that impulse control.
Yeah.
So they might blurt out whatever they're thinking, or, just do things impulsively, but it wasn't really a lack of understanding that this person in front of them might have a different experience.
Yeah, it's incredibly nuanced. Like here you have the ADHD person with the impulse control issue that is like butting into conversation. That we can consider some sort of like social feature. Totally different than the mentalization component that you find in autism. Now, like Dr. Jain said, there is total overlap. Like a large percentage of patients that have autism also have ADHD. Also, what I've seen is that there's social anxiety that you also see very comorbid with things with autism. How often are you seeing that in your practice? Now, what is social anxiety? It's the overestimation that you're going to be evaluated negatively by somebody else.
Right.
It's getting self-conscious, freezing up, overly censoring yourself while actually socializing. So do you see, I mean, I'm assuming you're seeing what I'm seeing, is that social anxiety comorbid in autism?
There is a lot of overlap. The difference is social anxiety is more rooted in that fear of judgment, fear of rejection, and embarrassment. So let's say somebody has social anxiety and doesn't have autism. They might understand what the right thing to do or say is in a situation. They're just very fearful about executing that or becoming involved. Where somebody with autism might have difficulty understanding that, which can understandably lead to anxiety. But it's a little bit different in terms of what's causing the anxiety.
Yeah.
Is it the fear of being judged and the fear that other people don't like them or don't want to hear from them versus just not understanding and knowing that they don't understand and feeling anxiety about it?
Mm-hmm. Yeah, that's fast. That's an incredibly interesting point.
You could think of them both as different programs in a way, where if autism is a deeper sort of processing program where you tend to become more fixated on certain interests, and whereas ADHD is more of like a fast multitasking program, so switching from one program to the next. So if you think of it with a computer analogy, somebody with ADHD might have many different tabs open, where someone with autism has one tab open and they have trouble switching between the tabs.
Oh, that's fascinating. Trouble switching between the tabs. Yeah. And then, like you were saying previously, those on the autism spectrum also have difficulty with transitions, changes. Like a lot of patients will report, well, a lot of my adult patients that have autistic children will report that it's really hard to go from, dinner time to bedtime or morning to getting dressed and ready for school. That transition, they have difficulty with transitions.
Going back to that computer analogy, if you have one tab open and you're very invested in whatever's happening in that tab, it is hard to suddenly be like, all right, next order of business. It's very discombobulating for somebody with autism. And it's, for a neurotypical person, we're switching tabs all day long, not really noticing it. With an autistic person who's experiencing everything so deeply, it's a big deal to switch.
Yeah. And I find that a lot of the irritability can arise when you are trying to get that person to transition and to switch. When the autistic patient is totally honed in and concentrated and fixated, and getting them to transition out of that tab that they're totally invested in can be a big trigger for meltdowns, irritability, anger, agitation, which makes it, it's difficult on parents a lot of the time. And again, what I was saying before, that sort of, hey, it's time to get ready for school, or hey, it's time to go to the bath, or hey, stop playing whatever you're playing and let's get ready for bed, is definitely a point of bringing upon like anger, irritability, acting out, and like the meltdowns you see in some like young autistic patients.
Yeah, I think that's why having a diagnosis can be so empowering for both the patient and the family, especially if they're younger. This is just understanding their child's brain a little bit better and how deeply they process information. And so, we live in a world that is really made for neurotypical people. And sometimes people with neurological differences can be disabled by that environment, by the world.
Yeah.
So it's helpful for parents to understand so that they can provide that environment where they know that their kid is experiencing the world very deeply and help them navigate that process.
If a parent were to ask you, Dr. Jain, what sort of advice or tips do you have to making these transition points throughout the day more smoothly? I understand my child is on the autism spectrum. How do I make this smoother, less disruptive?
Interestingly, as we talk about mentalization and understanding different viewpoints of others, I think it's helpful to do some mentalizing about what it might be like to be an autistic person, and to understand that if you're processing very deeply, you're going to need gentle transitions. Mm-hmm. And, what that might look like for each family might be different. And I think that would be helpful to speak with a therapist or provider about. But just having this idea that you're going to transition between tasks gently. So giving lots of warning, preparation, before you do something with a lot of sensory stimulation. So for example, if you're taking your kid to the airport and getting on the plane, really prepping them for that experience. So sitting down with them, explaining what's going to happen, explaining what they might encounter, so that it's not all overwhelming new sensory information for somebody who processes so deeply.
Yeah, that's great advice. Now, we've been using the word neurotypical. I'm sure everybody that is on social media has heard neurodivergent or neurodiversity. Let me define neurodiversity for everybody watching in case they're interested. So neurodiversity is the idea that variations in brain development and functioning, like autism, ADHD, dyslexia, are naturally occurring differences, not deficits or diseases, and that these differences should be recognized and respected as a form of human diversity. This was coined in the late 1990s by a sociologist, Judy Singer, and the neurodiversity movement emerged from autistic self-advocates online in the 1990s. They were tired of being portrayed as broken or tragic and proposed that we view neurological differences similarly to biodiversity, something valuable and enriching to society. Autism is not seen as a disorder to cure, but as a natural variation to be accommodated. So that is the best definition of neurodiversity that I was able to find, which I needed to find because when I was trained at UCLA in my residency, you can tell me if you had different experiences. Well, we went to the same program. I was never educated about the term neurodiversity in my residency training. I mean, was this term used? I mean, how was this defined for you, neurodiversity?
First of all, I love that description. I think that's very helpful and very appropriate. I didn't learn about it that much in the training. I did hear the word neurodiversity being thrown around, but it was really after my training when I started my private practice that parents would ask me about it, and I gained a better understanding of what the movement is really about.
Yeah.
And it's about celebrating differences in our brains and the way we process information as valuable to society, and that it's our differences that actually make society better, and that we should be creating supportive systems and societies to adapt to all different types of brains.
Absolutely. Now, here's a good time to inject the strengths that you can find in autistic individuals. Now, there is another side of the coin, right? We've spent this time talking about the difficulties, the comorbidities, the treatments, but let's spend some time focusing on the strengths and like the special sort of powers that those that are on the autism spectrum, have. One of them we've already talked about, this ability to be highly concentrated, highly obsessed in a healthy way with a certain topic, interest, hobby, and become like highly educated in this thing.
Right.
And this is where the term savant comes from, which is, as far as I know, a real thing, maybe 10% of autistic patients. So maybe you'll touch on what a savant is, but also what strengths do you see in this population?
Just to touch on savants first. A savant is somebody who has an extraordinary ability in one area. So it could be, in language, they might be a polyglot. They might be a math whiz. They can do lightning fast calculations in their head. Or they might be just very, very good at one specific skill. And And it is more common in the autistic population than the general population. So some studies have shown 1 in 20 individuals have a savant-like ability in one area. Coding would be another example. Anything that is a system-based learning where you have to put a lot of devotion, because they have that ability to focus, they can develop these skills. In the general population, I think it's 1 in 2,000. So it's much more commonly seen in autism.
Yeah, it's important to know that not all savants are autistic, but there's a higher proportion of patients on the autism spectrum that are savants than the general population. Now, speaking of strengths, some of the most accomplished people on our planet, in our history, have actually been on the autism spectrum. I mean, true. Are there any that come to mind for you?
So I think a famous example would be Greta Thunberg. She's a climate change activist, and her passion and dedication to being an advocate for climate change really comes through, and she's been able to make changes in our world and really increase awareness of, how Gen Z and also other demographics can be involved with advocating for climate change.
Absolutely. Hugely impactful. Now, I have a list here. I mean, Anthony Hopkins, an Academy Award-winning actor, revealed much later in life that he had an autism spectrum diagnosis. Dan Aykroyd, comedian actor. Courtney Love, musician and actress, stated that she had been diagnosed with mild autism as a child. Dr. Vernon Smith, a Nobel Prize-winning economist, publicly disclosed that he had autism. Dr. Henry Cavendish, if I'm pronouncing that correctly, an 18th century scientist who literally discovered hydrogen, was known for his social withdrawal and some autistic features. I mean, the list goes on. Now, point being that there is that other side of the coin, that the autism disorder, although there are some deficits that we discussed, does have that opposite end of this, or the opposite side of the coin of these great strengths and these great abilities to be accomplished, influential individuals in society. It's important to keep that in mind.
Yes. As you said, their interests can really develop into mastery of a topic, and they can make real world changes based on that. I think a lot of autistic individuals, because their mind processes information differently, are able to make connections between different things, and they can make real progress in fields like coding, mathematics, but any liberal arts as well. So they can,
really anything.
Yeah, really
it's
anything.
whatever grabs their attention and they fall in love with. I mean, they will fall in love with a topic, an interest, a hobby, whatever. Now, coming back to my earlier point, autism is just strangely hugely popular on Instagram, social media, TikTok. We have a huge influx of adults self-diagnosing online, coming to me asking for evaluations for autism. Now, we're asking a physician for opinion, right? Physicians are often we're a little hesitant to give our opinion because we're evidence-based scientific folks that like to parrot what the actual evidence says. But what do you think is going on here? What is this cultural phenomenon where autism is getting 1 billion views on TikTok, where people are self-diagnosing, where you have all these adults flooding in? What do you think? Why is there this huge popularity and cultural surge, especially online and social media, and fascination, honestly, with autism? What the hell is going on?
It's happening across all mental health disorders and diagnoses, first off. I think with autism, it is very underdiagnosed in certain populations, as I mentioned before, in women, BIPOC, LGBTQ populations. And so I think that learning about different experiences, and as we mentioned before, no two autistic individuals are the same. I think people are just really becoming aware of this, and it's really helping people. I think before there was a little bit of gatekeeping to a certain extent of only individuals who had professional training in autism, which wasn't even most psychiatrists in the past. Now I think that's different, but in the past, I think there was just a lack of awareness. So I think TikTok has really helped people understand themselves better. And so
A warning though, because what I started off by saying is that 70%, according to a study by Drexel University, of the information you see in these popular TikToks on autism is misinformation. So the pitfall I'm seeing is that a lot of people are attributing other comorbidities, social anxiety, ADHD, to autism. There's a lot of misinformation out there. So what I'm seeing is a lot of people are more curious. Do they have autism? It's certainly less stigmatized. The information is out there. I mean, I consider it mostly a positive thing. I mean, I would have to think about the negatives. But a lot of people, like you said, mental health in general, have more curiosity about themselves. The information is more widely available. And more people I have seen are drawn to get a better understanding of themselves and have less stigma in seeking professional help and evaluation. The misinformation, I mean, you're always going to have misinformation, but people's comfortability like seeking evaluations, I think is a positive thing. And also their drive to have more insight into themselves and have ways to work and improve themselves. I think it's positive.
yeah, I have some thoughts about that. So I do think that it increases awareness, which is always that's always good to have more information. I mean, as long as it's the correct information. But yeah, I do think it increases awareness, and it also can provide community, which I think is really helpful for marginalized individuals or people who, don't have access to that medical evaluation initially. So it's that initial spark of awareness that I think is really great. And I agree, a common pitfall is there's so much inaccurate information out there. I think sometimes it can be oversimplified. So if you have a checklist, five ways to know that you're autistic, I think, yes, that can increase awareness, but sometimes it ends up medicalizing normal behaviors.
Yeah.
I think everybody feels like they're masking to a little bit of an extent at different times in their life. So I think it's a really nuanced topic that requires professional evaluation eventually. So if you see something and you're like, maybe I have autism, I think that's a great starting point. And then the next step would be to get a professional evaluation. And I think it's really important to make sure you check what sources you're getting this information from. Is it content posted by a professional medical healthcare professional like a doctor, or is it not? You want to evaluate the source of the information. And I think it's great for community building, but you also don't want to be in an echo chamber where, you don't want to hold on to any diagnosis too much as part of your identity, because I think we're all unique individual beings. And
absolutely.
It's really about understanding your specific strengths and using that to live your best life in the world. And it's not about, limiting your life due to a diagnosis.
Yeah. And that's exactly why I brought Dr. Jain on the podcast today, is that, as I was sifting through the internet in preparation for this podcast for information on autism, there really is not enough information from experts child and adolescent psychiatrists who have subspecialized training in this topic. We need real, good, valid information out there because, again, the majority, 70% of the stuff that you see on TikTok is misinformation. So, again, we very much appreciate Dr. Jain coming on.
Thank you.
And Dr. Jain is, she's living by the words that she preaches to her patients. She's to come on a podcast like this. This is your first podcast, right? It takes courage. There's fear involved. You're exposed. You're talking to me. I'm asking you questions for like a couple hours. So it's, I admire that.
Thank you.
And she's walking the walk. She's not just talking the talk. I think a lot of your patients who end up seeing this are going to be inspired, right? It's very admirable.
Yeah, well, I've thought about it, and I do think that a lot of doctors don't put out content because there's a lot of pressure to say the right thing and make sure you are representing the field, and it feels like a big responsibility. But I also think we need more doctors to be on these platforms so that people can get the right information. And I think for me, it is a personal challenge to put myself out there, but I always tell myself, if I'm going to tell my patients to do things that are difficult for them, I need to be able to do that as well. So
absolutely,
like you said, walk the walk, talk the talk.
Exactly. And that's what we're doing here on Real Mental Health is we're bringing on young professionals, experts in their fields, to give you guys the actual information. Like Dr. Jain was saying, there's like this huge block for us doctors to come on and speak publicly about openly and freely for 2 hours, fully exposed, because we want to make sure we're not stepping out of line. Because we're evidence-based.
You're doing that as well, by the way.
Yeah, absolutely.
Every time you're on this podcast.
Absolutely.
So kudos to you too.
Thank you very much. Now, we have a ton of audience questions. Before we get to the questions, Dr. Jain, anything else we should hammer down on before we get to the audience questions?
I just really want to emphasize that it's helpful to think about autism as a neurodevelopmental difference. So a difference in the way that your brain processes. I think, a lot of times we think of it as a disorder, but as we've touched on earlier, there's a lot of strengths associated with that as well. So just being aware of how your brain works, it helps everybody.
Exactly. Listen, guys, there's nothing wrong with you. There's something that differentiates you from these like quote unquote neurotypical sort of like general population. And then if you're on the autism spectrum, you're differentiated again from like everybody else on the spectrum. So I would echo you. Try not to think about this as some sort of like disorder, like there's something like wrong. Think about it as some sort of difference that you can leverage, and think about the other side of the coin as far as like all the strengths and potential that you can harness with this sort of neurodevelopmental difference. Mm-hmm. Now, audience questions. We have a lot of them. A lot of people are excited that you're on here. Question 1. Do I have to tell people I'm autistic? Friends, potential romantic partners, employers. Do I have to divulge this information to people?
So first of all, no, you don't have to tell anybody anything you don't feel comfortable sharing. I do think it is helpful to share in the right situations with your school or your workplace so that the appropriate accommodations can be provided. Especially in school, I think it's helpful for your teachers to know, or the school administrators, so they can help set you up for success in school. And so I think that's a conversation a lot of parents have with their psychiatrists or neuropsychologists for their child about whether or not to divulge the information. I generally think it's a good idea in those situations. I also think it can help you improve your intimacy with people who love you, like your friends, your partners, your family. If they understand how you think better, you can get along better. You can improve your communication skills. You can meet each other's needs a lot better. So I always think more information and openness is a good thing. That being said, I know a lot of times people feel stigma or they don't feel ready. I do think when you're first sharing this diagnosis, it's good to share it with people who you trust before you fully step into that role of being able to just lead with that. In fact, I don't think it's something to ever lead with. I think you're just a person and you just process the world differently. So, but it's something that maybe over time, you become more and more comfortable sharing.
Yeah, I would agree. Now, the intimacy part is going to come into this next question, having to do with dating, love life. Should I be disclosing this to the person I'm dating? I imagine your answer is going to be the same. This is your information. It's medical, private information. At some point, if you want to let the other person in to develop that emotional intimacy and bond, that is wonderful. But I would really hesitate from feeling like a sense of shame or like there's some sort of problem that you're going to give this person this news and fear some sort of judgment. I would really do your best. And if that's a problem, talk to your therapist about it. But this is a vehicle of, hey, this is something about me that I want you to know, and let's get more intimate and closer together, rather than this is like something I have to like divulge or I'll feel guilty and have some sort of sense of shame about. I mean, that's how I counsel some of my patients when they ask me about this. I mean, what do you think about that?
First of all, autism doesn't have anything to do with your ability to experience love or the depth of your love. So people with autism can love just as deeply or even more deeply. So it really comes down more to how close are you with your partner, and do you want them to really understand how you think? Because I think that's a two-way street, right? Part of love is learning how the person that you love wants to be loved and vice versa. What are your needs in the relationship, and what are your communication needs? What are your emotional needs? So I think at some point, whether you use the term autism or not, it's helpful to explain, this is how I see love, this is what I need, and how do you see love, and what do you need, and how can we give that to each other?
Yeah.
I think that's what it's really about, more than I have this diagnosis and therefore I'm limited. That's not how I think the conversation should go, ideally.
Yeah. And I think that's one of the positives as far as it being so popular on social media and so destigmatized, is that it can take some of the shame and some of the, hey, I'm different, there's something wrong with me, and dispel that. And make it something that is less stigmatized overall.
Yeah, and I think it really comes down to nuances. So, for example, if an autistic person really struggles with texting nuances, maybe they just tell their partner, you know what, I'm not a huge texter.
Yeah, exactly.
It's not my thing to have this back and forth text. I prefer in person. Or sometimes I have sensory overload when, I need some space sometimes, or this is what is important for me to feel safe or comfortable. So I think it's just having those conversations, which honestly everybody needs to have with their partner.
Exactly. And I mean, I think most people can relate that when you are engaging in some sort of romantic, intimate relationship, there's always something about you that you feel a little hesitant disclosing. That's the definition of emotional intimacy. You're telling someone and showing someone all of you. Not everyone is Mr. or Mrs. Perfect that has nothing that they're a little bit like not ashamed or hesitant or worried. Everyone has something that they're like worried or hesitant to like disclose for fear of some sort of judgment. It's incredibly human. That's just what emotional intimacy is. It's opening up. By definition, you are being vulnerable by letting someone in and see all of you, the good, the bad, the ugly. And the risk is being judged, being not accepted, blah, blah, blah. But that's just a part of being a human. It's opening up, letting someone in, being vulnerable, taking the risk of rejection. And the rewards for that courage are so great that it must be taken.
Exactly. I think everybody has to go through the process of really learning themselves and understanding what their needs are in an intimate relationship. And I think that whether you have this diagnosis or not, that's what it really comes down to is, what are some of the assumptions I make? What are some of the fears I have? And what are the ways that I approach a relationship that are unique to me? And I think that takes time and experience with a partner to know.
Okay, so on the topic of getting more intimate with your friend, your romantic interest, a lot of autistic people, like you were saying in the beginning, they're masking. Let me act more neurotypical to avoid any sort of like negative judgment or being unaccepted. So as they try to gain more intimacy and unmask, what sort of challenges or what sort of advice or what do you see in autistic people unmasking to show all of themselves and get more intimate with their partners or their friends?
Yeah, that's a great question. So I think unmasking is usually, masking itself is actually something that a lot of autistic people have done their whole lives or from a young age. So it's really a process, and it's best done with a therapist or a trusted individual who understands what it's like to mask. And the first step would be to recognize when you're doing that, when you're masking. So when you're using scripted language, when you don't feel like you're being your authentic self, and when you're saying things because you think that's what other people want to hear or need. So that's the first step, is awareness. And then the second step is developing your own sense of self. Who are you and how would you actually respond in this situation? And are there some skills that you need to build to be able to express yourself in a way that other people can understand? And if so, learning those skills, and also just understanding how other people might interpret what you're saying. So it's really a process of learning some social skills and also just having more confidence in yourself.
Yeah, because you would hope that you reach a level of intimacy with your friends and your loved ones and your romantic partner that you are able to be authentic, you are able to be spontaneous, that you are not over-censoring yourself, that you are not acting in a way where the goal is being accepted by the other person rather than truly expressing and asserting yourself and being you.
Yeah.
Do you have any tips for people that are friends or romantic partners with autistic people? Any tips for them? How to make them feel more accepted, more comfortable, or any sort of advice at all for people that are friends or romantic partners with autistic people?
Sure. Yeah. So one of the first tasks I would say is for the person with autism to understand themselves better and what they need. And also for the person who is in a relationship with them or a friendship with them to mentalize themselves and put themselves in the autistic person's shoes. What might their world perspective be? How do they feel when they're in different situations? So I think the mentalization has to go both ways.
Absolutely.
And, there might be some kinks to iron out in the relationship. So communication differences and how both people can feel loved and heard, but in their own perspective or their own individual ways that are important to them.
Yeah.
So I think that is a conversation that needs to be had in a very intentional way. I think if you just hope to wing it, that makes it a little bit more difficult. So sitting down, having a conversation, if the person with autism can say, I really prefer communicating in this specific way. This is what makes me feel safe and comfortable. That way, the person who loves them can give that to them, and vice versa. Sometimes you have to step a little bit outside of your comfort zone because that's what your partner needs.
Yeah. And this is a relationship. It's reciprocal.
Exactly.
The autistic person is doing their best to mask or accommodate what they feel like their partner needs and deserves and expects and wants. But you are standing on the same equal footing as this other person. And it is also their responsibility to do the exact same.
Exactly.
To understand you. How do you feel? Does your brain work? What sort of expectations and needs do you have? What is you authentically like expressing yourself? So don't feel that just because you are on the autism spectrum, that you're not on equal footing and deserve exact reciprocity for your partner.
Yeah, I'll give an example. Every couple, I think, has to negotiate the idea of space. How much space do they want in terms of physical space, emotional space, mental space? And that is a conversation that both parties need to come in with full vulnerability and openness.
Yeah.
And I don't think that's any different than any other couple. It's just that sometimes I think it is harder for the autistic person to even realize what their needs are because the world hasn't been built for them.
Yeah. Now, next audience question. Mm-hmm. What is Asperger's? Is that even a part of the DSM criteria? Has that been absorbed into autism spectrum? What is Asperger's?
Asperger's is a term coined by Hans Asperger's in the 1940s. It was originally used to describe quote unquote high functioning individuals. So they have a normal or above average IQ and cognitive profile, but they have certain challenges with social communication. And up until 2013, we were using the DSM-4. Psychiatrists were using that as their diagnostic manual. And Asperger's was a condition at that time. But in 2013, we moved to the DSM-5, and now it's just one big spectrum. So we don't use the term Asperger's anymore in a professional setting. I think culturally, a lot of people know that term and understand that term. And so you still hear it, but it just describes somebody with an average or above average IQ who has certain autistic challenges.
Okay, Dr. Jain, quick fire, fact or fiction about autism spectrum?
All right.
Fact or fiction? Autistic people don't feel empathy.
Fiction.
Girls cannot have autism.
Fiction.
Autism always shows up in early childhood.
Fiction. I mean, it's there are some symptoms that you might see in childhood, but it doesn't mean that you're diagnosed in childhood.
Absolutely. Autism is a neurodevelopmental phenomenon. Mm-hmm. So it could easily be missed in childhood and then later picked up and diagnosed in adulthood.
Exactly.
Fact or fiction? You can grow out of autism.
False. Fiction.
All autistic people are either geniuses or nonverbal.
Fiction.
Fact or fiction? Everyone is at least a little autistic.
Fiction.
Fact or fiction? Autism is a mental illness.
I would say fiction in the sense that it's just a neurodevelopmental difference, but it is technically a DSM-5 diagnosis.
It is a DSM-5 diagnosis. It is a disorder, but as the neurodivergent movement, I would say, correctly asserts, is that there's pros, there's cons, there's a huge diversity of what you find in the autism spectrum. And again, there's the other side of the coin. Are there deficits? Yes. But are there strengths and positives equal to the deficits? Oftentimes, yes.
Yeah, so I'd be interested to see what happens in DSM-6.
Me too. Fact or fiction? You can diagnose autism with a blood test.
Fiction.
ABA therapy is the gold standard for autism treatment.
I don't know. I think it has been historically, but it really doesn't work for many individuals. So,
Autistic people are more likely to have anxiety or depression.
fact.
Autism can be cured with the right diet and supplements.
Fiction.
All stimming behavior should be stopped.
Fiction.
Screen time can cause autism.
Fiction.
Early intervention can significantly improve symptoms.
Fact.
Every autistic person has sensory sensitivity.
Fiction.
Eye contact is a reliable indicator of autism.
Fiction.
Autistic people prefer routine and predictability.
I don't know if I can provide a black and white answer. I would say fiction. I don't know that that applies to every single individual with autism.
Autism is more common today than in the past.
I think that's up for debate, but I would say fiction. I think it's just better understood.
Fact or fiction, UCLA is better than USC.
Fiction.
Fiction.
I'm sorry. It's where you go to undergrad. Fight on forever.
Hey, Zot, UC Irvine. Are autistic people less able to empathize? And what is alexithymia?
Autism, a lot of people with autism have the ability to experience high levels of empathy. It can even be too much. A lot of people with autism can actually absorb other people's emotions like a sponge. So the diagnosis of autism has nothing to do with whether or not you can experience empathy for others. And many people with autism have extreme empathy. There are two types of empathy, you could say. One type of empathy is the emotional empathy or the affective empathy experience. It's whether or not you can pick up on an emotion and experience it. The other type of empathy is cognitive empathy, which means, understanding why someone might be doing what they're doing. I think classically, a lot of people with autism can have high emotional empathy. They can pick up on the emotions of others, but they might have some difficulty understanding why someone might be doing or feeling the way they feel. And that comes down to their level of mentalization, which, by the way, there's a big variation in the neurotypical population as well.
Of course.
But, some people with autism can experience a lot of emotional empathy and still not understand why someone made the choices they made.
Yeah, that's a hugely important point as far as differentiating that sort of cognitive therapy versus the emotional therapy.
Yeah.
I think that's really important for the listeners to hear. What is alexithymia? What is that?
So alexithymia is difficulty labeling your emotions, understanding your emotions. So a person might experience a huge amount of sadness, but they might have difficulty identifying that emotion as sadness. And also have the emotional regulation skills to cope with that level of sadness. By the way, this applies to a lot of different people, whether you have autism or not, that you might struggle with labeling and processing emotions. I think it's a little bit more common in the autistic population to have difficulty with labeling your emotions. That being said, it's a skill and anybody can learn it, and regardless of your neurotype.
Yeah. And those that are familiar with my content know that a lot of what I do for everyone, not just autistic people, is helping people get in touch with their feelings, right? Labeling the feeling, what sort of physical state does this feeling bring on? I'm angry, I'm hot, I feel like my fists are clenched, my blood pressure and heart rate is elevating. What's the behavioral impulse associated with this feeling? Where is this feeling directed? So getting in touch with your feelings, identifying them, labeling them, it's not just a skill needed to be built up in autistic people. It's in people.
Oh, it's everybody.
It's everyone. Yeah.
It's me, it's you. We all, we all learn how to read and write, but unless your parents taught you, you probably didn't learn how to identify and express your emotions because it's not something that's really taught in a school setting or in a way that everybody has that access to that information. And it's a skill. You can learn it at any time in your life.
Yeah, absolutely. And it's hugely important because our feelings and our emotions is what should be guiding us.
Exactly.
It is the compass that points us to asserting ourselves, attending to our needs, and living a fulfilling, content life. It's guided by our feelings. So we have to be in touch with them.
Our emotions, I so agree with what you said. Our emotions are our compass to help us find what are our gifts and our strengths and help us develop happy relationships and careers that satisfy us.
Yeah, especially the relationships. Humans are relational beings, right? And the feelings, feelings typically a lot of the times are arising in the context of somebody else. So especially back to the unmasking and getting into a relationship with someone, whether you're autistic or not, understanding your feelings and asserting them are crucial, a requisite for being in a relationship that is reciprocal, where both people's needs are being met. There's nothing more important. I know I'm a psychiatrist, but there's nothing more important than being in touch with your feelings and asserting them.
Yeah, and I think that is a journey that everybody has to go through to a certain extent. And, a lot of people, whether you have autism or not, grow up in environments where certain emotions are not acceptable or not addressed. And it's a process that I think if you're going to live your best life, you're going to have to go through of recognizing that emotion and learning how to sit with it and process it, and it makes your life better. So
yeah. And as far as getting in touch with feelings, what Dr. Jain said, as far as like growing up and perhaps certain feelings not being acceptable, thus you not experiencing these feelings, all of that we cover in an earlier podcast I did with Dr. Mikey Cannell, also a UCLA trained psychiatrist, who I'm sure you know. We dig deep, and this is the foundation of like psychodynamic therapy. So anyone interested in that can go back and look at the podcast with me and Dr. Mikey Cannell. We dive deep into feelings and what was acceptable, what was not, and letting your feelings guide you.
Yeah, and I really do think it's a lifelong process, and I think we're all still working on it.
Yep. Absolutely.
Even you and me.
Constantly. Another audience question. A lot of patients ask me, hey, Dr. Mike, I feel like my child has autism. I'm having them see a psychiatrist. How do I know if this psychiatrist is the right person? How do I know if I can trust them? How do I know if this person is the right person to diagnose and thus treat my child who's having difficulty right now?
So I think, finding a psychiatrist you're developing a relationship with another human being. So, first of all, you want to be able to make sure you're comfortable and you can share everything that is happening. You want to, if you're talking to a psychiatrist and you're wondering if you should work with them, I would ask them about, what's their experience with autism? Do they have a lot of patients with autism? Is there anything what's their general approach to autism? I think if you ask that before you do the full appointment, that can give you a lot of information of if they would be a good fit.
Yeah, and my answer to this question is the same for any question as to, hey, is this the right provider? Step one, are they competent? Obviously. What's their pedigree? Where do they train? Are they competent? Step two, do I feel like they care about me or my family member that's seeing them? Do they care? What Dr. Jain said was, as far as like the introductory call before you establish care, what is your approach? How many cases like this are you seeing? What sort of specific approach do you have to the diagnostic and evaluation process? I would mimic a lot of what you just said. I think that's a great answer.
And I just have one more comment. If you are part of a population that is typically underdiagnosed with autism, such as female population or women, girls, if you are BIPOC or LGBTQ, then you want to ask about that specifically. What
Absolutely.
is your experience with these specific populations?
Bingo. Because like you said in the beginning, autism presents in very different ways across different demographics, boys, girls, BIPOC, LGBTQ. Excellent point. And I'll repeat what I said earlier to the audience. If anybody is looking for a psychiatrist, a child and adolescent psychiatrist, any provider at all in California or otherwise, you guys can leave comments below. We're happy to help set you up with someone that's an expert that cares. Thank you very much. So Dr. Jain, thank you very much for showing up. If anybody wants to contact Dr. Jain's office, it's Ocean Bay Psychiatry, located in the beautiful Santa Monica. We're going to link your website and contact information below. Like I started off by saying, send all of my child and adolescent referrals over to Dr. Jain's practice, which she shares with Dr. Francine Park, who's also a wonderful colleague at UCLA. So if you guys need a talented child and adolescent psychiatrist, oceanbaypsychiatry.com. We'll link it down below. Any parting words for the audience, Dr. Jain?
I think I just really want to emphasize how we can create a society where we accommodate and acknowledge everyone's differences, and it can be a beautiful thing. It doesn't have to be, we don't have to think of differences as much as a disorder, as much as a beautiful variety of different types of processing that can really benefit our society if we can learn how to accommodate.
Absolutely. And the first step of that is education, which you are right now contributing to. So I thank you. Everybody thanks you. If anybody has any comments or questions, leave them down below. And we'll see you on the next episode of Real Mental Health with Dr. Mike Ma. Thank you.
Thank you.